You know, sleep apnea is when your breathing and sleep is repeatedly interrupted. Now, a new study indicates it can also lead to more serious problems in patients with atrial fibrillation. Dr. Joseph Ogile from the Clayton Sleep Institute is here to talk about what it is. Good morning to you.
Good morning.
First of all, can sleep apnea cause atrial fibrillation?
Well, it is that you hit right on the point, which is there's the first study which was released last month in the journal Sleep, which is starting to connect obstructive sleep apnea, which is the obstructing of the breathing pipe while you're sleeping, to atrial fibrillation and a thing we call ischemic stroke, which is the most common form of stroke, which is where blood clots go to the brain.
Right, right. So what about if atrial fibrillation already exists and you have sleep apnea? That's a double whammy, right?
It certainly sets you up. It's clear in this study, which is a very nicely done study, that obstructive sleep apnea alone has been found to be a risk factor for ischemic stroke. Atrial fibrillation is also the biggest risk we see for ischemic stroke, but even without atrial fibrillation, obstructive sleep apnea is a risk as well. So you're seeing this. Our cardiology colleagues are very smart, and the patients who see them, more and more of them are being evaluated. If you have atrial fibrillation, being evaluated for obstructive sleep apnea. Close to 50% of people with atrial fibrillation will be found to have obstructive sleep apnea, so it's an important risk factor. It's quite important.
Are they treated the same way with the CPAP machine?
They're treated with some sort of device, some sort of mechanism to open their airway. Continuous positive airway pressure, or CPAP, is still the most commonly used approach.
And if somebody's out there saying, hey, he just described me, what are the symptoms we look for? What do we look for to kind of figure out whether we have sleep apnea?
So for obstructive sleep apnea, it's really helpful if you have a spouse or a bed partner who says, boy, you're snoring, I see you gasp at night, you're waking up. If you're sleepy during the day, certainly if you have any atrial fibrillation, hypertension, heart problems, and you have snoring or daytime sleepiness, discussing with your physician the possibility of being evaluated for obstructive sleep apnea is warranted.
And that means coming to see you, getting a sleep test, and you get to spend the night there, to have a little camp out with all these wires on you. I've seen the video.
And you enjoy that.
All right, thank you so much. Hey, if you want more information on this, if you have sleep issues, you might want to check it out. We've got links to not only the study, but Dr. Ogile's Clayton Sleep Institute as well. It's all on our website at fox2now.com. John?
All right, thanks, Randy. Thank you, Dr. Ogile.